powered by OECC ETWI Radiant Health Training. And this is me, Jennifer Milsey, and you're in Stereo Career Conference 2024, Series 4, Episode 18. And this is the case presentation competition. And today the case presentation is on rare and international case presentation or interventional case presentation, dermatology cases or ophthalmology case studies. And our judging panel expert for the Zone S will be Dr. Nagarjuna, Assistant Professor, Department of Pharmacy Practice, Karnataka in TVM College of Pharmacy. So let me introduce the judge to you. He did his PharmD from Nalanda Institute of Pharmaceutical Sciences, Karnataka, and worked as an assistant professor in SCS College of Pharmacy, Karnataka. And currently, he's pursuing his PhD in Savita Medical College, University Chennai, Tamil Nadu. He'll be judging today. Welcome, sir. Welcome to a competition.
Thank you for inviting us, and I hopefully thank you to Mr. Dr. Bharat for inviting for choosing as a judging panel, and my best wishes to all the students who are participating here. Am I audible?
Yes, sir, you are. It's our immense pleasure to have you today. Thank you so much for your participation, sir. Thank you. And for an information to all here, the quiz competition stroke survey will be conducted at 9 p.m. Quiz competition at 9 p.m. So make sure the participants who have enrolled already to be ready at 9 p.m. The topics will be anatomy and physiology of the brain, recognizing stroke symptoms, importance of timely stroke treatment, stroke prevention strategies, advances in stroke research treatment. Okay, with that being said, with no further ado, let's get into the competition. Our first participant will be Aki Ravadi from TVM College of Pharmacy, Bellary. Slot number SYCCON RX S48001. In the meantime, of our first participant getting ready, let me tell you the rules. You'll be given 5 minutes for your presentation, and then you'll be having discussion with our judge. When the 4 minutes ends, I'll warn you with a 1 minute more signal with you. And exactly at 5 minutes, we'll be stopped. So make sure to present within 5 minutes. And when I call your slot number, make sure to unmute yourself and present your screen and start presenting. Now, moving on to the first participant, Aki Urabadi, TVM College of Pharmacy, Bellary, slot number SYCCON RX S48001.
Hi, good evening, everyone. Am I audible, ma'am?
Good evening, you're audible. You can start presenting.
Yes, ma'am. I'm gonna share my screen. Is my screen visible, ma'am?
Yes, yours is visible and you
Okay.
can start. Your time starts now.
Eh, Good evening to everyone. I am Iravati Aki from TVM College of Pharmacy. I'm studying in third PharmD. Today, I'm here to present a case on post-TB sequelae. First, let us know the introduction. What is tuberculosis? It is a bacterial infection that mainly affects the lungs and can also affect any part of the body. TB is caused by Mycobacterium species. Those are M. tuberculosis complex, M. tuberculosis, M. bovis, M. africanum. What is this post-TB sequelae? These are the anatomical and pathophysiological changes in the chest wall, which are secondary to the complications of pulmonary TB. These changes may result in pulmonary dysfunctions, which can vary from minor abnormalities to severe breathlessness, increasing the risk of death from respiratory causes. Coming to the patient demographic details, a 51 years old female patient was admitted to female medical ward with chief complaint of abdominal distension since 3 days, abdominal discomfort since 3 days. History of present complaint. Patient was apparently normal and is a known case of pulmonary and abdominal tuberculosis. Now presented with a history of abdominal distension since 3 days, insidious in onset, progressive, no aggravation on relieving factor. History of abdominal discomfort, history of loss of appetite, history of breathlessness on exercise. Past history of TB 1 year back from which the patient has taken treatment for 2 months and discontinued, now diagnosed with PTB, abdominal TB 1 month back. Past medication, the patient was on ATT, that is anti-tubercular therapy. Next, coming to the plan of care, CBC, LFT, that is liver function test, RFT, renal function test, electrolytes, ECG, echocardiography, biochemistry, and CRP is a C-reactive protein test, and pleural fluid analysis, and USG abdomen test. Next, coming to the lab parameters, AST, that is aspartate aminotransferase, total bilirubin, direct bilirubin, indirect bilirubin were abnormal. And next, other parameters, lab parameters like USG abdomen was found to be moderate to gross ascites. Pleural fluid analysis was found that total proteins, sugars, and cell type like lymphocytes and RBCs were present in the fluid. Next, assessment based on the subjective evidences like abdominal distension and discomfort and objective evidences like abnormal lab parameter, the patient was diagnosed with post TB sequelae. Next, coming to the treatment, injection ceftriaxone of 1 gram IV was given every day in the morning for 7 days. Injection ceftriaxone belongs to the class of third generation cephalosporin. It acts by inhibiting bacterial cell wall synthesis. Next, coming to the injection pantoprazole of 40 mg IV was given every day morning. Injection pantoprazole belongs to the class of H plus K plus ATPase pump inhibitors. This pump inhibits the gastric acid secretion in the stomach and thereby prevents the gastric acidity. Next, injection ondansetron is a 5-HT3 receptor antagonist which inhibits the chemotherapy induced nausea and vomiting. Tablet ATT, in which there were ethambutol, levofloxacin, and streptomycin drugs were involved. Ethambutol is an anti-tubercular agent which mainly targets TB mycobacterium species, which interferes with the cell metabolite synthesis and impairing the cell metabolite synthesis, leading to the cell death. Levofloxacin belongs to the class of fluoroquinolone antibiotics, which main action is bactericidal action, and this levofloxacin inhibits the enzymes like topoisomerase 4 and DNA gyrase, which are important for DNA replication, synthesis, transcription, and translation. Tablet streptomycin belongs to the class of aminoglycosides, which is again a bactericidal in activity. Its main action is inhibiting the microbial protein synthesis. IV fluids were also given to the patient. Tablet B complex was given, and the tablet pyridoxine hydrochloride was given as a treatment of prophylaxis in as for treatment for prophylaxis for isonias induced neuronal periphery. Next, injection noradrenaline was also given, and tablet spironolactone was given. Here, the tablet
1 minute more.
spironolactone tablet spironolactone is which excretes sodium and water and retains potassium. Discharge medications were also given. Coming to the patient counseling, tuberculosis is a bacterial infection, and tuberculosis is a communicable disease which spread through droplet infections. Some of the common symptoms of tuberculosis are fever, fatigue, loss of appetite, weakness, nausea, vomiting, weight loss, abdominal pain, headache, chest pain, night sweat, etc. Coming to the prevention, good ventilation is required, respiratory hygiene is required, childhood vaccination is required, TB prevention treatment like uh, are also required. Lifestyle modification, isolate the patient in the separate room, advised to wear the face mask, maintain hygiene environment, cover your mouth while walking, talking, sneezing, take fiber rich food like wheats, oats, etc. Take brown rice, avoid non-vegetarian foods, avoid oily foods, spicy foods, should take plenty of fruits, vegetables, and take medications without skipping the dose. If any dose is skipped next time, don't double the dose. Take medication with more water,
And
eat
thank
leafy
you. Your
vegetables.
time has ended. Thank you for your presentation. And now moving to the judges.
Mhm. Your presentation is good, ma. So our questionnaire will start now. What do you know about pulmonary TB and extrapulmonary TB?
So pulmonary TB is TB attacking the lungs, sir. And extrapulmonary is apart from lungs, all other parts like abdominal TB, genitoureteral TB, miliary TB, brain TB
Okay.
will be
So
affected.
next question, ma. What do you
Yes.
know about Montague's test?
So Montex test is a test, exclusive test for to assess the to check the TB, sir, and it is a skin test, sir. Montex test, it is also called as a medial Montex test, Montex screening test, tubercular sensitivity test, sir, in which in this
Okay,
test
okay,
some of the
wait.
antigens.
Okay, enough, enough, enough. What do
Okay,
you
sir.
know by regiment Cat 1, Cat 2, Cat 3?
Sir, there are three main regimens, sir. In category one, like the patients, new sputum spear positive patients, uh, they are choose to give the tablets or a HRZD regimen for 6 months, sir. Like
Okay,
that, there are
okay.
three categories, sir.
Actually, HRZD like this is there, but even in
Yes.
your case, they choose an ethambutol like these drugs now. Why they choose an
Sir,
apart?
the patient might be resistant for those drugs, sir, and or showing some more side effects. So the doctor have changed to ethambutol, levofloxacin, and streptomycin.
Okay, what is the route of transmission, ma, for this disease?
Sir, this is a droplet infection, sir. From infected person droplets through breathe, air, it will spreads.
Okay, what is the better diagnostic test for TB?
So better is Montex test, sir. If not, is a chest X-ray radiography.
The last question, ma.
Yes, sir.
So, how we can prevent this TB post TB sequelae?
The treatment should be taken properly, sir. Medication adherence is important, and if any more side effects, the patient should reach out doctor very soon. They should not delay.
Okay, tell any one two counseling points for this patient.
Sir, the patient should be isolated in a separate room, and he should always wear the mask when he leaves that room. And taking medication adherence is very important in TB patients, sir. If patient takes or skips any medication, there might be chances of resistance of that medication. And taking the healthy food is important, and wearing mask is also important, sir.
Okay, ma. Overall, your presentation is good.
Yes, sir. Thank you, sir.
Okay,
Thank you
thank you.
very much.
Well done,